Today we're going to be placing some PDO threads in our patient to create lift to mid-face and the jawline and the neck. And I will be talking through this procedure and letting you know how it goes. Today we have the perfect patient for this procedure. Kim is in her early 40s and she's just starting to see some signs of tissue laxity. So we're going to pull up the tissue that she has that is kind of starting to sag. This will be Kim's third or fourth treatment. She likes to have threads placed about every 6 months, which is ideal because at about the 6-month point, we start to see the skin laxity start to increase a little bit more, and we can start to see some collagen development that's ongoing. So keeping up with it, similarly to how you would keep up with your dermal filler, is recommended with PDO threads. So I will show you the rest of the procedure and talk through the steps. The first step in the PDO treatment is to map out the area that the patient wants to focus on. So we always look at where the skin laxity is and where we want to pull the tissue from each angle, and then we draw out the trajectory of the thread. So here you see us starting at the lateral canthus and marking our spot there, and a couple threads heading over the cheek and down toward that jowly part that sometimes we get along the jawline. This other angle is at the angle of the mandible laterally, and as we target the corner of the mouth, we can actually pull that up for a patient who might have a downward turn that is starting, or that can also be quite severe. The thing about PDO threads, which is really awesome, is that we can see an immediate mechanical lift from about 3 to 5 millimeters in the face. And then over time, the collagen that develops will continue and increase and just give this wonderful, very long-lasting effect. The second step of the procedure is to do some local anesthetic in the area where we will be inserting the PDO threads through our cannula. We use a combination of lidocaine with epinephrine in this area, and it is a little bit stingy, but the patient's quite comfortable after, as you can see here, as we are inserting our 18 gauge needle to create an insertion point for the PDO threads that are loaded inside of a cannula. This is also the same procedure that we would use if we're using a cannula with dermal filler. Here we can see the first of our PDO threads being inserted, and as the provider hits that mid-dermal plane, the cannula slides quite easily, and we can see that our patient is in no distress at all. It's quite comfortable, also considering that she's had a oral block, which leads to added general anesthetic, pretty much the full face. This procedure without anesthesia can be quite painful. So during our trainings in class, we go over the various methods of anesthetizing your patient's face so that they are comfortable and not experiencing an undue amount of pain during the procedure. Here we see a second thread being inserted through the same insertion spot, and this massage upward helps ensure that the barbs along the thread are securely in place. And then we can give the threads a nice tug, making sure that they're secure. If there's any indication that the thread might be placed too superficially, we can adjust it a little bit by pulling on the end. Threads can be easily modified while they're being placed. However, after complete placement and snipping, it can be quite difficult to remedy any situation, and especially to completely remove the thread. Here we see a PDO thread being placed toward the corner of the mouth with a nice strong palpation to secure the barbs. PDO threads placed along the jawline can help restore the contour there and the structure that we often lose over time. By adding the threads under the jaw, we can also add contour there and head towards the submental area and create a pull there that can affect the neck tissue. PDO threads are the only non-surgical treatment that can effectively lift the tissue of the neck. The final step in the PDO thread insertion is the clipping of the ends. Prior to this step, we will be sitting the patient up, having them smile, making sure there are no issues at all. The biggest adverse event that could happen with a PDO thread is a thread that's placed too superficially and it can be visible under the skin, and it can be fixed even without any intervention at all. The PDO threads will dissolve and that would eventually go away. There's no downtime with the PDO thread procedures. You can see here, typically no bruising. Patients are happy. You see the results immediately. If you have any questions about PDO threads, please leave it in the comments below. Give us a call or email us, follow us on Instagram, and subscribe to our YouTube channel.